Professor Adrian Puren is the Executive Director of the National Institute for Communicable Diseases, and he joins us now via Zoom. Prof, thanks very much indeed for joining us. Welcome to the programme. Should we be alarmed that we've got yet another virus that's visiting our shores?
No, I don't think it's a matter of alarm. I think it's certainly being informed. I think it's very important. Certainly, this particular outbreak is the largest outbreak in terms of when you look at the previous history of this particular virus. So we certainly have a large outbreak, which is unusual. And we just need to be aware, and certainly it's important that the contact tracing, both forward and backward contact tracing, takes place in order for us to identify any other individuals that may have been exposed or either do actually also have the infection, and those be identified, get tested, and go into isolation. I think it's important for us to try and limit as best possible the further transmission of this particular virus, but not to be alarmed. It's a very different virus from coronavirus. It's relatively inefficient compared to coronavirus in terms of its transmission. And as you heard in the clip, it does not cause severe disease in the main, and it's really self-limiting. It's that 2 to 4 week period of pretty unpleasant experience of the rash and so forth. And it's during that particular period, of course, that contact should be limited, and therefore isolation is recommended in order to limit further transmission.
Do we have any idea at this stage? We probably don't know how case number 1 got it, but is it probably at a community level now already?
No, my sense would be, again, that for the general population, and again, we don't know how it will evolve in South Africa, but if you look at other countries, for example, it's not in the general population. The risks are low in the general population. There are specific networks, social or sexual networks, that are thought to be involved in the transmission in the current scenario. But again, in South Africa, it's not clear that this is the case currently. So it's important for us to investigate and to determine, in order for us to have the appropriate means of preventing transmission in South Africa. So you're quite right, this individual that was identified does not have a travel history. And that goes the same for Europe and the United States and the UK, again, where cases were identified where there's no evidence of actual travel to endemic regions in terms of the possible mode of transmission of this particular virus.
So can we assume, though, that it's almost certainly imported by someone, even though the person who's got it now didn't travel?
Yes, absolutely, and that's not. One would like to think that we're all protected in the sense, but we're, as you know, we're part of the global travel community. Yeah. So yes, importation is the most likely route that this has occurred. Yeah.
When people come through our borders, monkeypox isn't on the list of anything, really, is it? So is this why sometimes it can come in, or will there be checks going forward, or not?
No, I don't think so. I think that, again, I think it's a matter of educating our communities to be aware of that this is a virus in circulation. The risks are fairly low, but that where there are specific networks where we think that, for example, specific sexual activity occurs as a form of transmission, that those, again, be alert and be aware. And of course, people who are traveling outside and returning to South Africa who've participated in events which are thought to have been sources of high risk in terms of transmission, that they present were they to become ill and have a rash of unknown origin. So I think that's really critical. So I think we have to steer away from the stigmatization. That's really, really critical in order for people to freely present themselves for medical care and aid in the further transmission of this particular virus.
Is there a particular demographic group of people that is particularly vulnerable to monkeypox?
So in this current outbreak in so-called non-endemic countries, it's really in the younger age groups, specifically males, and specifically males who identify as having sex with men. And again, that's been the major demographic, but it's not the only demographic that is associated with this, but that is the major demographic. I think it's very important to note that this is the demographic, again, who are not protected against smallpox, who've not received smallpox vaccine. And that will go, for example, I'm sure even in so-called endemic countries, whereas the levels of smallpox vaccine exposure declines, we may well see an increase in cases. But in this particular instance, my sense is that it's a coincidental event that happened in Europe and in other places within that specific group of social or sexual networks.
So treatment, what does one do? There's no vaccine. Do you get a smallpox shot? What do you do?
Yeah, so the approach that I think South Africa will likely adopt, given that the vaccine is always hard to come by, and some of the antiretrovirals as well may not be easily sourced. But the main way in which this will be managed is really critical is the identification of cases, isolation of individuals, and then behaviors at home or in specific settings to limit transmission will really be critical. Because again, it's not a severe disease in the main. I think the main outcome or unpleasant outcome is really the fact that there will be the scarring.
Yeah.
So I think in the main, it's self-limiting. I think there are specific categories of individuals, such as the immunocompromised. Again, we need to be concerned about that. Pregnant women and in children less than the age of, I think, 8 or 10, who have poorer outcomes. It can have, in certain instances, poorer outcomes, such as a bronchopneumonia or meningitis, but again, those are very rare. So the utilization of a vaccine under these circumstances, such as so-called mass vaccination, is not recommended at all. There may be specific settings, again, maybe laboratory workers or healthcare workers, where you can certainly apply the vaccine. Whether that will happen in South Africa, I think will probably be under discussion, I'm sure.
All right, so tell us about the cycle. From the moment that you get infected, when do you start becoming symptomatic? Can you infect other people almost immediately?
No. So this virus has, in the main, has a fairly lengthy incubation period, up to about 20 days. But it can, I think in the main, be about between 5 to 13 days of incubation. And this is then followed by the presentation of, for example, high fever, lymphadenopathy, in other words, enlarged lymph nodes, muscle pain, tiredness, weakness, for example, will be the initial characteristics. And during that particular phase, the 3 days following that, you can start transmitting. And then the rash arises. And the rash, again, this can be highly variable, but can start at, for example, the face, and then spread across the body, particularly the hands. And again, in this particular setting that we've discussed in terms of the United States and UK, US, it's also the rash can be seen in the genital area as well. And it's during this phase when the rash appears that the levels of transmission can certainly, or the exposures can lead to transmission. It's only thought that transmission ends when you actually have healthy skin back in place. So even though you have dried skin and so forth, the virus may still be active or viable in terms of transmission. Hence, I think hence the recommendation that in a home setting, for example, again, there should be separation of activities and contact in order to prevent transmission.
All right. I know that there are, I'm told, 2 types of monkeypox. One might be a little bit more virulent than the other. Do we know which one this man has got?
So sequencing will certainly reveal that. It's most likely to be the less virulent form. I think this is the West African variant. And it's thought to have less poorer outcomes in terms of the so-called case fatality rate. interestingly enough, so far, when you look at so-called non-endemic countries, the overall case fatality rate is less than that has been reported for so-called endemic countries. So the behavior so far is very different compared to what has been previously reported.
Okay, all right, so we'll leave it there for the time being, but I think the message is caution, no need for alarm. If you become symptomatic, isolate, isolate, isolate.
And get tested. I think that's important. Yeah, absolutely, because it's important for, if you do have this particular virus, again, clinically it's very difficult to distinguish sometimes from other infections. So it's really important to get tested, and it's therefore important, if you were to be identified to be infected, that both the prospective and retrospective tracing and tracking takes place in order for us to limit transmission.
Prof. Puren, we'll leave it there. Thank you very, very much indeed.
Sure. Thank you very much.
That's Professor Adrian Puren, Executive Director of the NICD, speaking to us about the one case so far that's been identified of monkeypox. But the message very loudly, it's not like coronavirus, behaves very differently. No need for alarm. And once you get symptoms, go and get tested and isolate.